Welcome to the Fitness Contrarian. My name is 𝙒𝘼𝙏𝙏 and I've been a personal trainer for over 20 years. In this video, we're going to be talking about tennis elbow. First, we'll explain to you what tennis elbow is. Then we'll give you some quick tips in which you can alleviate tennis elbow quickly. Then we'll talk about how to strengthen the body so tennis elbow will never come back again. We're going to be taking 3 different approaches to strengthening the elbow. First, we're going to look at the body as a whole. We'll look at an integrated way of strengthening the body so you can prevent tennis elbow from coming. Then we'll look at some isolated movements you can do to actually strengthen the elbow itself. And then we're going to mix the two together. We're going to be doing exercises that integrate and isolate the body at the same time. What tennis elbow is basically tendinitis on the outer side of the elbow. You know, doctors like to call it 𝙈𝙊𝙍𝙏. Itis meaning inflammation. So basically, this is the right hand. The outer part of the elbow gets inflamed. The tendons are swollen, the muscles are sore. There can even be some like microscopic tears in the tendon. Now, it can actually be pretty painful, tennis elbow. A lot of people who have tennis elbow don't even play tennis. But in this video, we're going to gear this video towards people who are playing tennis. Okay. Some of the things you can do really quickly, I have found, to alleviate tennis elbow is, first of all, you have to deal with your tennis racket. I found that the first thing to do is just loosen the strings in your racket. Just by loosening the strings in your racket, it takes away the vibration of the tennis racket and takes a lot of the pressure off the elbow. Okay. The second thing you can do is I would definitely talk to your tennis pro, go to a place where they sell tennis rackets, and tell them the type of racket you have. You might want to consider changing tennis rackets. Some tennis rackets are designed to absorb the vibration of the tennis ball a lot better than others. Basically, you may want to switch to a racket that's a little bit more flexible and a little bit less stiff. So by having looser strings in the racket, by maybe changing tennis rackets or having a more flexible racket, that alone is going to make a big difference in getting rid of tennis elbow. Okay. The other things you can do is you can wear one of those tennis elbow bands. I don't have one with me. I did bring a picture of one. So hopefully you can see this in the video. It's basically those little straps. I know you've seen a lot of people wear these things playing tennis. You know, you pretty much put it an inch down on your elbow. It basically takes the vibration away when you hit the ball. It also it acts as a stronger forearm muscle. That's another thing you can try. The other thing you have to do is that you have to ice. It's most importantly if you can ice like right after you play tennis. You know, when you're playing tennis, the elbow gets inflamed, it gets aggravated. I would ice it. The ice will get rid of the inflammation. The other quick tip you can do is you can take anti-inflammatories. You know, obviously, before you start any type of program, speak to your doctor, you know, speak to a physical therapist, make sure you're able to take anti-inflammatories if you choose to do so. But taking anti-inflammatories is another great way to get rid of the inflammation. The problem with tendinitis is that when it's really bad, you really have to rest it. You know, if you rest it, the inflammation will go away and it will heal. But most tennis players don't want to take the time off. I understand, you know, people want to play tennis, they want to have fun. So if you do want to keep on playing, the three or four things I would do right away is consider loosening the strings in your racket, make sure you have the right tennis racket, a flexible tennis racket, make sure you know which the grip is correct, make sure it actually fits your body, the racket. I would always ice directly after you play, and even as often as you can, ice for 20 minutes. I would consider wearing one of those tennis elbow straps, and if you're able to take anti-inflammatories, I will take anti-inflammatories. When it comes to strengthening the body to get rid of tennis elbow or to prevent tennis elbow, the concept of an overuse injury, like tendinitis is an overuse injury. Basically, your body, for some reason, when you're hitting the tennis ball, your elbow is working really, really hard, harder than you can tolerate. So the muscles become inflamed and tendinitis starts. Okay. The problem with trying to strengthen the elbow alone is that most likely, in most cases, when someone gets an overuse injury or when someone gets tendinitis, wherever you're feeling the pain is not really where the problem is. I know that's a little bit hard to understand. If you've been in this fitness industry for a long time, or if you're obviously a physical therapist, doctors know this. Okay. If you're getting tennis elbow, there's something that you're doing when you're playing tennis that's making your elbow work 10 times harder than it should be. And that's why you're getting tennis elbow. So if you try to only strengthen the elbow, you'll never truly solve the problem. So in this clip, in this part of the video, I want to talk about an integrated way of strengthening the body to prevent and to heal tennis elbow. Okay. What you really have to do is have someone just analyze your whole body. But I'm going to give you a few tips that are pretty much the most common reasons why people get tennis elbow. Okay, for example, if you're a right-handed player, most people get tennis elbow from hitting their backhand. Okay? So basically, if you're stepping forward and you're hitting your backhand, see how the body is rotated? If you have some type of limitation, if for some reason why your body is not coiling, your body is not loading properly, where you're not able to get your body around the ball to hit that backhand, what are you doing? You're putting excess pressure, too much pressure on your elbow. Your elbow has to do all the work of the backhand. Okay? So basically, if you're going to do a backhand swing and you're turning, what's happening is that you're rotating your whole body to the left, and you have to see where the limitations are. Most commonly, what I found over the years, the biggest problem for people who get 𝙒�プ𝙏𝘾𝙃, tennis elbow in their right arm, is they have tightness in their left hip. Their left hip is not internally rotating enough. It could be coming from somewhere else. It could be coming from, your spine, from your thoracic, from your lumbar. But I found over the years the most common reason for people getting tennis elbow on the right side is tightness on the left hip. So in this next clip, I'm going to show you some exercises I think you should do to loosen up your body and to get you ready to play tennis. Okay, so here are some integrated exercises you can do that's going to help you coil your body better, help you load your body properly, and increase the flexibility in your hips, in your spine, across your entire body. Once you have this increased flexibility, it's going to take the pressure and the stress off your elbow, and hopefully tennis elbow will just go away. The first thing I'd like you to try is basically just a squatting motion with a rotation. Just like this, you're going to squat and rotate. You're going to squat and rotate to the left. Then you're going to squat, rotate to the right. Squat, rotate to the right. Okay? That's a nice way to get started. It's pretty simple to do. It's going to increase the flexibility in your spine and in your hips. Okay, after you've done your rotation squats, now let's try that same movement more specific to tennis. Let's do it more in a lunging position. See, now I'm in a lunge position. Now I'm lunging and rotating. Lunging and rotating. Lunging and rotating. Now I'm really opening up this left hip. Always do it evenly though. Always do it on both sides. Lunging, rotating. Lunging and rotating. That's another great movement to open up the hip, to open up the spine, to let you load the body properly to prevent tennis elbow. Now the final exercise I'd like you to do is to mix the two together. I'd like you to lunge forward and do a rotation, like you're hitting the backhand itself. You're going to lunge and rotate. You're going to lunge forward and rotate. You're going to lunge forward and rotate. And do it on both sides. Lunge forward and rotate. Lunge forward and rotate. Lunge forward and rotate.